You're evaluating an older cat admitted for a routine procedure, but her heart rate is lower than you'd expect for a hospitalized cat. She's bright, calm, no history of collapse. Nothing about the exam feels particularly dramatic until you look at the ECG. The atrial activity looks regular, the ventricular rhythm looks regular, but the two are completely unrelated. This is complete heart block. Hi, I'm Dr. Haley, a board-certified veterinary cardiologist. I teach ECG interpretation through physiology and electrical mechanisms rather than pattern recognition. By the end of this video, you'll be able to describe complete heart block step by step on ECG, explain exactly what's happening with the conduction system, and understand why this rhythm behaves differently in cats compared to dogs. Before we talk about complete heart block, we need to revise normal atrioventricular conduction. Remember, in normal sinus rhythm, electrical activation begins in the sinoatrial node located in the high right atrium. The SA node produces a wave of electrical activation that spreads across both atria. That produces a P wave. The electrical impulse then enters the AV node. From there, it conducts into the His-Purkinje system and produces the QRS complex. The key feature here is coordination. One atrial depolarization, one ventricular depolarization, a predictable relationship between the P and QRS complexes. This coordination is what ensures efficient ventricular filling and stable cardiac output. Now remember, the heart has a fibrous skeleton which electrically insulates the atria from the ventricles. And the AV junction is the only normal electrical bridge between them. If that bridge fails completely, the atria and ventricles must function independently. So in complete heart block, atrioventricular conduction is completely absent. No sinus impulse reaches the ventricles. And the atria and ventricles are now electrically independent. They are no longer synchronized electrically or mechanically. So what happens when there's no communication from the atria to the ventricles? Well, when atrial impulses fail to reach the ventricles, ventricular activation depends entirely on an escape pacemaker. In cats, that escape rhythm is most commonly junctional. That means that the pacemaker originates near the AV junction rather than deep within the ventricular myocardium. As a result, ventricular activation spreads normally through the His-Purkinje system, and the QRS complexes are narrow. In cats, the junctional escape rate may appear relatively fast, somewhere in the range of about 100 to 140 beats per minute, compared to what we typically expect in dogs. And that's why complete heart block in cats is often better tolerated than in dogs. So going back to the morphology of the QRS complex, where the escape rhythm originates determines the QRS appearance. As we mentioned, a junctional escape rhythm with the impulse initiating at the area of the AV junction produces a narrow QRS complex, whereas a ventricular escape focus that spreads by slow cell-to-cell depolarization creates a wide QRS complex. As mentioned, in cats with complete heart block, the escape rhythm is most often junctional. So in this case, the narrow QRS complex does not indicate normal AV conduction. It indicates that ventricular activation occurs from a junctional pacemaker. Let's take a look at the ECG of this cat and describe what we see before naming anything. So we can see that P waves are present, although they can be a little tricky to decipher because some of them are hidden within the QRS complexes and the T waves. We probably have one hidden here somewhere, here, hidden here, and so on and so forth. We can see that the P waves look regular and they're positive in lead 2, which reflects an underlying sinus rhythm. You can also see the QRS complexes that are present. These also look regular in timing, but the morphology is not normal. We're going to talk about deciphering that a little bit more in another series, so stay tuned. But let's get back to it. We can see that the QRS complexes are regular in timing, but their timing doesn't match that of the P waves. And we can see no fixed PR interval. So there's no consistent relationship between the P waves and the QRS complexes. The atria and ventricles are marching independently. Now this pattern, the regular P waves or regular atrial activity, combined with the regular QRS complexes or ventricular activation, with no relationship between the P and QRS complexes, as well as more P waves relative to the QRS complexes, in this patient defines complete atrioventricular dissociation. And now we can name it as complete or third degree AV block. Complete heart block in cats is usually not transient, and the most common mechanism is degeneration and fibrous replacement of the AV conduction system. This is what prevents all sinus impulses from reaching the ventricles. This is a structural interruption of conduction. Once present, atrioventricular synchrony can't be restored electrically. The ventricles are permanently reliant on an escape rhythm. Clinically, one of the key consequences of complete heart block is loss of AV synchrony, where atrial contraction no longer contributes predictably to ventricular filling, and cardiac output becomes entirely dependent on the escape rhythm. However, many cats have a relatively rapid junctional escape rhythm that allows them to remain asymptomatic or mildly affected. In those that are symptomatic, permanent pacemaker implantation is indicated. So key take-home messages. Complete heart block is defined by complete loss of AV conduction, where the atria and ventricles are independent of one another. In cat, ventricular escape rhythm is often junctional and narrow complex. So if you want to go deeper into rhythm recognition in cases like this and actually understand why ECG patterns behave the way they do, that's exactly what we teach inside Opti. Opti is a clinical case library where rhythms are expanded into full patient cases with mechanism-based ECG interpretation, clinical context, and step-by-step reasoning. If you want to access the complete Opti ECG case vault, you'll find the link in the description. I hope you've enjoyed this breakdown of complete heart block in a cat. I look forward to seeing you in our next case study, and I hope you have a great day. Take care.